My name is Mackenzie Meldrim. My student ID is 3254433. This is for my clinical pathology 1 class, and in this part of my video I'm going to be demonstrating how to do a blood draw. So we have our patient and he is in sternal recumbency. We have our restrainer who is going to be occluding the vein. We're going to be using the cephalic vein. And these are the materials I'm going to be working with. I have my syringe with my 22 gauge needle. I have my collection tube, and I have my alcohol. So I've already preemptively shaved the area, and this is to prevent any contamination when you insert the needle, so you don't contaminate your sample. So I am going to go ahead and first thing I'm going to do is I'm going to locate my vessel. Stay. Stay. You're okay. Go. So after I've located my vessel, I'm going to clean it with alcohol. And I'm going to open my syringe. And so with one hand, I'm going to stabilize the vessel, and with my other, I'm going to insert it. One more time. And since I've touched it again, I need to clean it with alcohol again. And so I'm going to gently aspirate the blood into my syringe. And you want to make sure you don't go too quickly because you don't want to collapse the vein. Apply.
Dr. Roman, the cat from the bed is owner on 1.
Okay, and once I have the amount that I need, I really don't need a lot. I'm going to pull my needle out and apply gentle pressure to my site. And I'm going to take my syringe, and when I transfer it into my tube, I'm going to take the needle out, or off, excuse me, and we do this so we don't cause hemolysis by forcing the blood through the needle. And then the next thing I'm going to do is I'm going to write the patient's information on here so I don't get confused as to who blood this is. My name is Mackenzie Meldrim. My student ID is 3254433, and this is for my clinical pathology 1 class. In this part of my video, I'm going to be demonstrating how to make a blood film, how to stain it properly, and then how to review it under the microscope. So first thing we're going to do is we're going to make our blood film. I have my anticoagulated blood in my EDTA tube. So I'm going to take some of it out. And I have my 2 slides here for the microscope and a pipette to suck up some of the blood. And on one of my slides, I'm going to put a tiny drop of blood at the end of it. And then with my other slide at a 30-degree angle, I'm going to bring it back until it comes in contact with the blood. And then I'm going to slide it in one fluid motion across the slide. Okay. So it's a little hard to see right now, but as you can see, there is, at the end here, there's a tapered, feathered edge. And then we have thicker blood as you go along this way. So we're going to let this, we're going to let it dry, and then we're going to move on to our next step where we're going to stain it. So now that my blood smear has been dried, we can move on to our staining process. We use Diff Quick stains here. So the first one we're going to use is the methanol, and that's a fixative, so it's literally going to fix the our sample onto our slide. So I'm going to leave it in for about 10 seconds, and then we'll move on to our next slide. And then you'll want to dip it on here just to make sure you don't contaminate the other slides. The next one is the eosin, and it's an acidic stain. and it's essentially our red stain. So all the pink that you see on that stain is from the eosin. Make sure we close them up. And then our last slide is the methylene blue, and this is a counter stain to the eosin. It's also acidic. And once we're done with this one, we're going to take our distilled water and we're going to get rid of any excess stain that we have on our slide. And I'll be placing my slide with the sample facing down so I don't take off my sample. And I'm going to run my distilled water down the slide. And I'm going to have my slide facing upwards so that any of the excess water drips down and away from my stain. And then once it's done drying, we'll move on to actually looking at the slide underneath the microscope. So now we're going to review our blood film. So the first thing we're going to do is we're going to look at our entire stain under low power magnification. And what we're going to look for is platelet clumps, nucleated red cells, microfilaria, basically anything that looks abnormal. So we'll go ahead and do that. And then once we've basically done that, we are going to move on to our high power magnification. And at this point, we're going to look for our feathered edge and our monolayer on our stain. And you can tell the difference between the two of them because the monolayer has a very evenly distributed cells, and the feathered edge has more erratically distributed cells, so you can tell the difference by them. So once we have located them, we can go on to our next step. All right, and once we've done that, and once we've found our monolayer and our feathered edge, we can then move on to finding a spot on our monolayer adjacent to the feathered edge and look at it under the oil immersion magnification. And this is where we will be doing our manual differential cell count. And I'm not actually going to demonstrate it, but what you would do at this point is you would count about a minimum of 100 white blood cells, and you would count them, record them, and identify them. And that is how you review a blood film. My name is Mackenzie Meldrim. My student ID is 3254433. This is for my Clinical Pathology 1 class, and in this part of my video, I'm going to demonstrate how to perform a packed cell volume and a total solids test. Packed cell volume is the percentage of whole blood that is comprised of red blood cells, and it's used to determine if there's any presence of pathologic conditions such as anemia in the blood. And in total solids, the total solids test is used to find the total protein concentration. So to get started, we're going to take our hematic capillary tube, and with our anticoagulated blood, we're going to suck up about 3/4, and we're going to take the tip of our tube and kind of compress it so that we sort of suction up the blood. And again, we're going to fill it to about 3/4. So that's about 3/4. And we're going to plug it up with our clay. And you may need to do it a few times to get a complete seal. So now we're going to bring this over to our centrifuge and we're going to have it spin for about 3 to 5 minutes depending, and once it's done we'll move on to our next step. Okay, so now that our tube has finished spinning, you can see that there are 3 layers. There's the red blood cells, there's the buffy coat, which is comprised of white blood cells and platelets, and then we have our plasma at the top, all this over here. So in order to read the packed cell volume, we're going to go over to our chart, and we're going to line up the bottom of the red blood cell line at the bottom of it, and then we're going to match it up to the top of the plasma line, and then we're going to see where our red blood cells end. So it's at 50%, which is normal for a dog. So then we're going to move on to our total solids. So what you would do in this case is you would take a microscope slide and you would score it right above the buffy coat. In that case I broke it, but you want to break it either way. And then I'm going to take my plasma and put it onto my centrifuge and just lightly tap it. Try to be careful with the glass. And I have coming up at a 5.2 for my total solids.